talking about the project Alaga Ka, an advocacy that was started by the Department of Health. And Dr. Kaycee Reyes over here was the project manager. So now let's move on to the other beauty regimens that are available in the market. And just to mention that Dr. Kaycee also took up alternative medicine like acupuncture, herbal medicine, homeopathy, you know, just, and that's interesting because a lot of the doctors wouldn't bother with that, no? They would just go straight the traditional medicine.
Yes.
But it's interesting since we're Asians, right? And we have also all these other alternative medicine available.
Yes.
You know, it's interesting to merge them together and custom fit it to the patient.
Yes.
Right? So there's also the Ayurveda, you know, the ancient
yes.
herbal medicine of India. Then you have the Chinese herbal medicine.
Yes, and even exercise. With exercise, you have Qigong, yoga.
All right. Okay. And so what do you think about the alternative medicine with regards to beauty? Like, for example, how does acupuncture help staying well and beautiful?
Yes.
Yeah.
With alternative medicine, it's better to call it complementary medicine, because what I do, if I just say that I'm practicing alternative medicine, I'm just doing the traditional medicine. Better if I use evidence-based medicine combined with this with alternative, and that's what you call complementary medicine.
Complementary.
Because I rather use evidence-based machine, evidence-based treatments.
Yes.
So I can tell my patient, there are lots of studies, significant studies regarding this procedure. Then I will just I'll just give her or him some inputs about the alternative, just in case he's interested with that procedure.
Yeah. Ones that would complement
yes.
what do you call it, the science
the science between Western and Eastern.
Right. Okay. So if you notice that you know, I have this skin that was scarred because of cystic pimples,
Of course,
no?
yes.
But I'm very fortunate. Well, even in my later part, you know, of my life, right? There are all these machines like Fraxel, Thermage, and Cyton, you know. These are laser machines that help improve the skin.
Yes. Yeah. There are so many machines available today that will improve your skin, and that will promote or that will delay skin aging. First of all, before I recommend machine to my patient, I ask them first what's your intention. If they say I want to delay aging, I tell them first, you should know more about skin aging first, or facial aging, before I can recommend this kind of machine, because each machine has a different mechanism. So for example,
and lifestyle, no, Doc?
Lifestyle, yes, number one, lifestyle. Opo.
Okay.
With skin aging po kasi, there are two processes of skin aging. Number one is intrinsic and extrinsic. Intrinsic aging is caused by natural passage of time, by genetics, and by hormone. While extrinsic aging is the cause of everything outside the body, like lifestyle.
The environment and the lifestyle, the environment.
Lifestyle.
Whether it's the sun, whether it's the winter, whether it's the pollution, right?
Some individuals, they look younger than other individuals because each individual, we have different genetic makeup. So some people, they age faster, but the truth is the beauty is 30% nature and 70% by nurture. So you really should take care of yourself, because it will improve your personal life and professional life, and it will enhance your self-esteem. So with aging, number one cause of aging, the number one is the most important factor, the single major factor that causes aging is the sun. Sun exposure.
Which we have a lot of over here.
Yes, because UV rays, even if it's invisible, it produces a protein, the metalloproteinase, which it's an enzyme that breaks down collagen. So there's a thinning of the skin and then the atrophy of the skin. So you lose elasticity. Also, it promotes more pigment formation. Like for Asians like us, or for people with darker skin, we have more pigments or melanin in the dermis, in the middle layer of our skin. So, and we have more capability or ability to produce more pigments. That's why we're more prone to post-inflammatory hyperpigmentation or to tanning compared to Caucasians. Like us, number one sign of aging for us is pigmentary problems like
Yung nangingitim,
Yes.
no?
Opo.
Uneven skin tone.
Opo,
Yeah,
number one.
alright.
Unlike for Caucasians, the number one sign of aging for them are wrinkles.
Wrinkles.
Yes.
That's right.
So, second cause of aging is smoking or pollution, because because this one, the smoking, it produce free radicals that promote formation of proteins that break down collagen and elastin. It also decreases the moisture level of the skin and increases vitamin A level of the skin. So it dries your skin. And then number three, the frequent facial expression. Like that's why sometimes some people you see number 11 on the forehead, because they usually use this muscle. So it creates in the long run,
yeah.
they create lines.
Ah.
So
No, but they say like, laugh lines,
Laugh lines.
They say that's, you should always have a good laugh.
Yes.
And that would help with your facial expression, I don't know. But
Yes.
there is also such a thing as laugh lines.
yeah, that's very good, the laugh lines. But what we want is not to make it over prominent. You just want it to be subtle. So, and then number four cause of aging is the environment. If you have low humidity environment, the tendency is to dry more.
Yes,
to
so
dry
you
the
lose
skin.
the moisture.
Sure, you lose
right.
the moisture.
Uh-huh.
So for the face,
Like for example, when you're in a controlled environment, like air conditioning
Yes.
or heaters, that affects the skin, right?
Yes.
Okay.
Yes. Totoo po yan. That's really one of the major concern. And then, for facial aging, you can see there's one study, as I was saying earlier po, there's a global standard of beauty. There's
Alright.
a study that studied 5 population all over the world,
Yes.
and they discovered that people agree of what beauty is.
All right.
Like for them, global standard of beauty is high forehead and
That's what we have. We have
high,
that, no?
yeah, we have a high forehead,
Okay.
and then wider eyes and slightly angled, aquiline nose, the beak-like nose. That we don't have that.
Yeah, the big like nose.
And then high cheekbones,
All right.
and then full lips and prominent chin. So that's the standard of beauty, global standard of beauty. But as we age, what happen is, we create furrows, we create lines, like prominent line wrinkles, and then the eyebrow,
And then the eyes, the crow's
crow's feet,
no?
yes.
Over here in
Yes.
and then,
The eyebrow droops, and the cheeks flatten.
yeah.
And there's the nasolabial lines and the marionette lines become more prominent, and the chin, it decreases the width of the chin. What happens is there's a bone loss. As we age, there's a bone resorption. The bones become flat. And also the face is made of fat compartments, the fat pads. As we age, the ligament that separates the fat compartment, it gets lax. So it goes down. And the fat, it lessens, so everything goes down. So the angle of
It's
beauty...
the law of gravity.
Yes. The angle of beauty used to be inverted triangle, but as we age, it becomes triangle.
Oh,
Yes.
all right.
And then for the skin, what happens? The pores becomes bigger, and you tend to form veins, vessels, and also pigmentations, and there's loss of elasticity. The skin becomes sallow. So from that, you can see you can target the volume. You cannot you use laser to to decrease the pore size, to
Okay,
remove the pigment,
Yes.
to elevate the acne scars.
And also to activate the collagen.
Yes,
Yeah.
because when you use lasers, like for example, there's an erbium glass laser or carbon dioxide laser. It targets connective tissue. It creates microtrauma. With microtrauma, there's you promote natural wound healing. So there will be
Yes.
collagen remodeling and collagen formation. With some lasers, there's a laser is a single wavelength. Some lasers, they target the pigment. So what it does, it target the pigment and destroy the pigment, and it get metabolized by the body, but you will require several sessions. That's why you cannot find you cannot treat all the problems with one laser. So
Yes, it's a series.
yeah, and lasers, they're not created equal. I mean, it's like cars. You have
The high end.
the high end and the
yeah,
low
the
end.
low end.
The high end, it's better to use that because you can see there's significant studies that shows that it's really effective. And for the volume, what we do, we can do injectables. Contrary to popular belief that here in the Philippines, you don't usually promote Botox. People think that you should do Botox when you're already 40 or 50. But the truth is, Botox, it's better if you start early.
Really?
Yes.
Well, anyway, we'll take a short break. So stay with us. We'll be back and talk more about this
Yes.
treatment. Okay. All right.
Thank you.